The aged are said to be the repository of wisdom and knowledge. However, in Ghana, old people sometimes suffer abuse, discrimination and neglect. This is in spite of the national aging policy introduced 3 years ago to ensure proper care for the aging and the aged. Often, this treatment results in them going early to their graves. A National Stakeholder Consultative Forum on Care for the Elderly has been held in Accra, during which participants made a number of recommendations that should ensure that the aged enjoy a better quality of life.
It is not uncommon for a retired colleague to pay a visit to his colleagues at the office and ask for some money before taking leave. But this may not have been so during his active years in service. The care and support for older persons in Ghana has been the responsibility of the family and to some extent the community. These older persons may reside in the family house and receive care from the entire members of the household. Demographics show that in 2012, there were 1.53 million Ghanaians aged 60 years and above. This represents 6% of the population. Records also indicate that about 1.6 million are above 60 years, but only 1,000 of them receive pensions. And about 1.5 of them live in a deplorable condition, which is also said to affect their lives. These elderly people, especially the women, are sometimes accused of being witches and are neglected and even ostracized.
Older persons have a stock of experience, have a stock of knowledge, and they also have a stock of expertise that we can channel into national development, cohesion, peace, and progress for our country, Ghana.
The National Stakeholder Consultative Forum on Care for the Elderly shared thoughts on issues and made recommendations that will enable the elderly in society to enjoy a better life. The research showed that 3 main aging issues, namely old age and poverty, old age and health conditions, and old age and migration patterns are the main problems. The experts say the national aging policy was introduced to see to it that the aged in Ghana are cared for, but the council to see the policy's implementation and funding has not been established. The research also touched on the Livelihood Empowerment Against Poverty program and the National Health Insurance Scheme for the aged. A member of the National Pensioners Association, Mrs. Janet Iseku, spoke about life after retirement.
The net pension is 100 cedis. If you have to take a vehicle from your home to the bank, as they were saying, sometimes you get there, the money is there, they have not worked on it, and they tell you it is not there. If that happens, it means you have to be going there a few more times. By the time you realize that even transportation has eroded all the money you are going to collect.
The National Stakeholder Consultative Forum on Care for the Elderly is an initiative of the TUC and the Danish Union of Public Employees.